My name is Dr. Kudrat Jain and I'm a consultant psychiatrist at Cosmos Hospitals, Delhi. Today, I will be talking to you on the topic of suicide and how we can go about increasing our awareness about the same and being more sensitive in dealing with individuals who are at risk. In simpler terms, it means to injure oneself, a self-inflicted injury with the intention to die or end our life. If the action actually results in the loss of life, it is termed as a completed suicide. However, a suicide attempt means that the action did not result in the end of life, it was a non-fatal outcome. However, the intent to die was still present. Now, the risk of suicide is present across all age groups and across all genders. However, there are certain sections of people which are more at risk. Talking about them, the elderly, the older individuals, the male gender, individuals who are facing difficulties in their workplace, say in terms of work-related pressure, unemployment, individuals who are facing difficulty in their education front, academic failure, poor academic performance, studies-related pressure, peer-related pressure, individuals who are facing difficulties in the family life, interpersonal family conflict, relationship conflict, and that relationship can be any relationship, whether it's parents, siblings, significant others, friends, family, any relationship. If there is a difficulty in the relationship, it can predispose for a higher risk of suicide. Individuals who often turn towards the use of substances to solve their problems are at a higher risk. Individuals who have poor or faulty coping mechanisms to deal with the problems in their life are at a higher risk. Individuals who have a constant, daily, ongoing, stressful life scenarios are at a higher risk of suicide. Who do not have a poor, proper social support, people whom they can fall back upon in times of need, are at a higher risk of suicide. Certain sections of the society, like economically weaker sections, the sections who are isolated, marginalized, are at a higher risk of developing a suicide attempt. Patients of chronic physical illness, where the outcomes are not very favorable, the prognosis is not very good, do have a higher risk of suicide. One of the major risk factors is one or more past attempts of a suicide. If there is a history of that, there is a significant higher risk of attempting suicide in the near future. Another section of people, another area where the risk of suicide is significantly high is patients with mental illness, individuals with mental illness. Almost across the spectrum of the mental illnesses, whether it's depression, whether it's schizophrenia, whether it's chronic substance use, substance dependence disorders, there is a significant increased risk of committing suicide. Now, we meet a lot of people in our daily life. Whether it's at home, it's at workplace, it's at school, college, we meet and interact with a lot of people on a daily basis. Now, there are certain warning signs, certain subtle indicators, which if identified early, if picked up early, can help us identifying a person at risk and help us in providing them with timely help, timely intervention, and prevent the loss of a life. Certain indicators like significant disturbance, significant deterioration in the sleeping and eating habits. If we feel that an individual has become very irritable, they're getting angry at very minor matters. If we feel that they have become isolated, their interaction has reduced to a bare minimum. If we feel there have been significant crying spells, they are turning towards substances to solve their problems. There's a significant decline in their work or education-related matters, significant absenteeism. These issues, these indicators do point towards a risk of suicide. If we feel that the individual is spending more time talking about death or dying-related matters on the topics of afterlife, on the topics of attaining moksha, attaining salvation, they can also function as certain warning indicators. Or experiencing a sense of like they have accomplished everything in their life and there's nothing else left, they can also function as certain warning indicators and subtle signs. If we find that an individual is spending more time in researching about suicide and the related topics, or investing more time collecting items related to suicide and the related paraphernalia, they are certain subtle warning signs which we should not ignore. Now, after having discussed in brief about what can be the warning signs, how should we go about helping them? The first and the foremost thing we should do is to create awareness amongst us, amongst our family, friends, colleagues, to be more sensitive in these matters. When we are approaching anybody, if the person who we feel that is at a risk, if we are approaching them, we should do it in a safe and a comfortable place and in a very comforting manner, in a very non-judgmental and a non-biased manner. If they are willing to share their problems with us, we should try and offer hope from our side. We should try and offer alternative possibilities, alternative solutions. However, we should keep in mind that it should not appear that we are being overpowering or we are being dominating. When the concerned authorities are involved, say for example, the office administration, college, school administration, they should be taken into confidence. The families of the individuals, whether it's parents, whether it's siblings, whether it's the spouses, they should be taken into consideration. They should be made aware of a certain of these indicators. Vigilance should be done. They should not be allowed to venture out on their own. They should not be allowed to take their medicines or prescription tablets unsupervised. That should be taken into consideration. We should encourage them to seek professional help, and at the same time destigmatize the fact that they should consult a professional, mental health professional for their help. And if we feel that there is an imminent danger to life, we should not hesitate from getting the legal authorities or the police involved so that the loss of life can be prevented and the individual can be given an immediate medical attention. Now, in brief, we've discussed about the warning signs, how we can go about helping them. Now, why are we discussing about this? Why is that the focus of our discussion today? 10th of September is commemorated as the World Suicide Prevention Day by the World Health Organization, WHO. Now recently, if I mention about India, the National Crime Records Bureau recently compiled a report of 2021 which said that the suicide rates in India were the highest ever in 2021. About 1.6 lakh people died by suicide last year in India. That was about 7 to 8% higher than 2020 and 2019. So let's take this as an opportunity. Let's take this World Suicide Prevention Day on 10th of September as an opportunity to increase our awareness, to be more sensitive, and to help the people and not let them suffer in silence. Thank you.